We always with progesterone in a premenopausal woman. That's going to be the best treatment for her. It's going to treat PMS type symptoms. It can treat hot flashes, the perimenopausal hot flashes. Those are not brought on by estrogen deficiency as they are in a menopausal woman. So it's going to be effective in that. It's calming, it's mood stabilizing. That's going to be one of the biggest game changers for a perimenopausal woman is progesterone. It helps with so many things and improves quality of life. It decreases her risk of breast cancer. You would want to stay away from cream for sure because it doesn't raise blood to a therapeutic level. It's just not well absorbed through the skin. The highest I've probably ever seen it on a cream is around 3, and we would want to get around 10. That's where they get symptom relief, a minimum of 10 in a perimenopausal woman. It's going to be different for postmenopause. The sublingual is our choice because it's absorbed very well. You just place it under the tongue. It takes about 4 minutes to dissolve. It brings levels up beautifully. It's not the most pleasant tasting hormone. It's kind of a bitter hormone. The pharmacies will put some flavoring in to try to help women with that. But it does raise blood levels really well, sublingual. But then oral is also a possibility. The problem with getting it orally is you only absorb about 40%, and so sometimes it's just not enough. It does cause drowsiness when you take it orally, so if women are having trouble sleeping at night, then that might be something good to consider. But usually you'll have to do a little bit of sublingual to go along with it to get it in a good range. So that's like, well, if you're going to do sublingual anyway, why not just do sublingual? And then you don't, it's just more cost effective if you're just taking one troche a day as opposed to having to take a troche and a capsule.